Hello, everyone. I want to welcome you to our School of Physical Therapy virtual information session today. We're very excited to have you join us. I am joined by some distinguished guests. We have with us Dr. Powers, and I'm going to let her introduce herself. And then after that, we have our student ambassadors or admission ambassadors, I should say, and I'll let them introduce themselves as well. We'll start with Dr. Powers.
Hello, everyone. I am Dr. Gina Powers. I've been with the university for just around 10 years. I started as adjunct faculty and made my way up through. I'm now a core faculty member. I teach largely in the first year. You'll see me for anatomy courses and within kinesiology, and then right up into gait analysis. So it's nice to be here with you all this evening.
Yes, thank you for joining us. All right, and we are excited to have our admission ambassadors with us as well, who are current students in our DPT program. We'll start with you, Peter.
Hi, I'm Peter. I'm a second year DPT student. I'm from New Jersey. Yeah.
I'm Arthur. I'm also a second year DPT student, and then I'm from Everett, Mass.
And I'm Greg. I too am a second year PT student. I'm from Connecticut and supposed to do our undergrads. I went to Sacred Heart University.
I went to UMass Boston.
I went to University of South Carolina.
All right, excellent, excellent. And last but not least, of course, my name is Tammy Trainer, and I serve as the Assistant Director of Admissions here at MCPHS. Work very closely with the School of Physical Therapy, so I'm super excited to be with you this evening. So we're going to let you know a few things before we get started. So this session is being recorded. If for some reason you have to step away or you're unable to stay with us for the duration of the session, please let me know. Send me an email or give us a call in the admissions office, and we'll be more than happy to send you the link for you to be a part of the info session and to get the content. And last but not least, if you have questions throughout the session, there is a Q&A section at the bottom of your screen, is a little box with the question mark. If you can place your questions in there, we'll be sure to address those questions with you towards the end of the presentation. All right, so I want to start out with talking a little bit about some facts, wanting to know, did you know? So healthcare is a great field to pursue at this time. Not only is healthcare one of the largest employers in the United States, but with an aging population, job openings are projected to increase over the next decade or so. MCPHS is a healthcare-specific university offering 100 programs in different healthcare fields. Healthcare is definitely our specialty. So many of our faculty have clinical sites where they have affiliation, which means that we are up to date on the current healthcare system. And additionally, all of our students are working towards a healthcare profession. Did you know that we have been around for quite some time? The university recently celebrated its 200th anniversary last year. We started out as a small pharmacy school in Boston and have now grown to over 7,500 plus students between our Boston, Worcester, and Manchester campuses and our online branch. And finally, did you know that MCPHS prides itself on maintaining clinical affiliations with some of the leading medical institutions in the nation? And we're going to review a few more of those clinical sites later in the presentation. So when you're talking about or asking yourself, why MCPHS? So at MCPHS, we believe the true value of a college education is what your degree does for you after graduation, which is why we are proud to prepare students for exciting and fulfilling careers in the health sciences. We empower our graduates to take advantage of the exponential growth of the healthcare industry, where 1 in 3 new jobs will be created through 2026, according to the U.S. Bureau of Labor Statistics. And to let you know, we are currently #1 for earning power. So MCPHS reached the top of the Wall Street Journal / Times Higher Education College Rankings list, surpassing the University of Colorado, Denver, Georgetown University, and Harvard. MCPHS graduates are trained for high-paying careers in high-demand fields. All right. So before we go into housing, I want to ask each of our admission ambassadors if they can tell me why they chose MCPHS. We'll start with you, Arthur.
I chose MCPHS due to like the convenience of it being so close to home as well. And then I also chose MCPHS because of the integrated clinical experience that we kind of get to go through, which I thought was a unique part in this program that are not a lot of different programs offered. And then working closely with the admissions staff, being able to like they kind of helped me through the entire process and really treated me like a family. So that's how like I kind of came through my decision.
All right, thank you for sharing that. All right, Peter, let's hear from you.
So I chose MCPHS because of the strong curriculum they have and how we get all of our coursework done before we head out to clinicals. So once we're on the clinicals, we have all the necessary like base knowledge we need to be able to go into a clinic or a hospital or any different type of setting to be able to treat patients at the highest level that we could at that point, where some other programs have clinicals like built in throughout the coursework. And I felt that if I was able to get all my coursework and skills done first, I would better be able to transition into clinical settings that way.
Excellent, thank you for sharing. All right, and last but not least, let's hear from you, Greg.
Yeah, so for a lot of the same reasons. I think the major factor for me choosing MCPHS was our integrated clinical experiences, which I think we'll get into a little bit later in this presentation, but that was my big deciding factor. I haven't been able to find that sort of integration into a program at any other university. And aside from that, I just wanted a change of scenery for my undergrad. I think the location that our university is at is like perfect. We're like not quite like I guess we are kind of downtown sort of, but not like we don't get all the traffic and anything that like a city gets. Worcester's close to Boston without the Boston traffic, so I kind of like the environment that we're located at.
Yeah, all right, excellent. Thank you all so much for sharing that. Which takes us to our next slide, which is talking a little bit about housing. So believe it or not, even though this is a graduate program, we still offer housing to all students that would like it. So we are located in the city of Worcester. The couple things to remember about housing is that our housing, we try to make sure that the prices are competitive. So what we've done is we've surveyed the surrounding real estate opportunities within this area, making sure that our rent is competitively priced. You'll also find that they come fully furnished. Units come with your couch and tables, as you can see in the pictures in the slide, which is great because you don't have to really worry about moving a whole lot of furniture when you're coming into the apartments. Also, all of your utilities are included in the rent. So not only are they fully furnished, but you don't have to worry about having separate bills as you are paying your rent each semester. So if you want to learn more about our housing, definitely go to our website and go to the word visit. and you can definitely schedule a campus tour. We would love to have you and show you around, and you can see some examples of what our housing has to offer. Now, I know that our admission ambassadors have lived on campus. If you guys can share with our participants, how have you enjoyed living on campus? And do you feel that it has enhanced your opportunities to meet others and to collaborate with others in this program? We'll start with you, Greg.
Sure. So I've loved living on campus. Certainly when I got accepted over a year now, I was looking at opportunities off campus, trying to find the cheapest available option, and looking like outside the city, trying to find somewhere to rent, whether it's apartments or houses. I couldn't really find anything super comparable to the prices that we offer at MCP, being that like our rent is included into our tuition. You don't have to worry about paying for it. Like each month, it just goes straight into your tuition bill, and then like all utilities are included, so you don't have to worry about finding gas, water, electric, Wi-Fi bills. That's all included for us in that one price. So I think the convenience of that was the biggest thing for me sticking with campus housing. And I also went random. I ended up getting paired with Arthur. So lucky enough, that's my bud now. The admissions team works to like put you in an environment with ideally someone that's going to be in your same situation, that'll be in your program. So even if you don't know anyone coming into campus, I would say take advantage of the university housing, because they'll pair you with someone that's going to be in the same situation. We mesh pretty well, so worked out.
Oh, great, great, great. Now, Peter, I know your situation started out a little bit different. Can you share with us?
Yeah, so being from New Jersey, I knew I had to live on campus because I would not be able to make a 3.5, 4 hour commute every day. So I started living here at Lincoln. So on campus, where all your classes and labs are held, there's also a connected building that is a renovated and converted hotel building that I lived in, which was super convenient and super nice to be there my first year because I was able to, be in the building, not have to worry about traffic or walking in, bad weather or anything like that. I didn't have a roommate, but it was still super easy to connect with my classmates. We're with each other all the time, and we become very close very quick. So now this year, I live in a different on-campus housing with a roommate now, also in the PT program. So I would say that being able to live on campus definitely connects you much easier than if you were to be commuting or traveling from far away to get to class every day, because it takes some time out of your studying, takes some time out of your schedule, and just to be able to be here, if you're able to, it makes life in general like a lot easier when it comes to the schoolwork.
That's excellent, excellent. And really quickly, Arthur, do you feel like having a roommate or living on campus has made learning easier or more accessible for you?
Yeah, I think especially like how Greg was just mentioning, me and him are roommates, so we got like fortunate enough to be in the same program and the same like year. So obviously we all have the same exact courses. So having a roommate was like really beneficial because if I'm studying or he's studying and we have a question on something, we can kind of bounce ideas off each other. And like if we have to practice for a skill check or something that's coming up, we can like kind of practice at each other at home. Also the convenience of like living on campus being such like a close walk. I think it's like a 5-minute walk from the school, in case like people want to study late at night, and like the BMW space, which is our like kind of PT clinic space that we have, being so close to that and like having unlimited access to that is like really easy, because then whenever you need to practice for something or study, you have the space to use it, and others in your class that are also living on campus can also access it as well.
Wow, right, great. Thank you all so much for sharing that. All right, so that takes us to our next part of our presentation, which is talking about bringing the health sciences together. We are going to talk a little bit more about interprofessional education, but this is definitely something that sets MCPHS apart from other institutions that are healthcare focused. So IPE is a collaborative program that brings students together and faculty from different disciplines, schools and campuses to teach and learn from one another. So I believe it's once a semester or so where students will come together from different disciplines and learn that collaborative effort. I mean, you know, we can't feel as a healthcare worker that we work in silo. I mean, that's just not best practice. You know, you want to be able to know how to talk to other people that are on the healthcare team of your client or your patient. And so this is a really great way to do that. And like I said, we're going to talk more about what that looks like a little bit later. All right, so now we're going to get more into the program's philosophy, and I know this is Dr. Powers' expertise area. So Dr. Powers, if you can kind of explain to us a little bit about the program philosophy and how it was designed.
Absolutely, happy to. Our overall goal of our program is to make successful clinicians, right? We want everybody graduating from this program to be the best PT possible. We work to achieve that by keeping our curriculum very contemporary, presenting the latest evidence and the latest details, and then applying that curriculum clinically. And we allow for that with clinical rotations, but then also our integrated clinical experiences occur right from the get-go in the first semester. And that allows for some immediate experiential learning and immediate application of the skills that you are learning. Our ICE is very much set to match each semester as far as the courses you're working on, then seeing clinical application in the settings that apply to those courses. Then ideally, we want you to reflect on those experiences, and that ability to self-reflect makes a big difference in your performance, and then essentially moving into community learning, taking everything that you learn here and applying it with our community practice opportunities and those service opportunities that do exist. So we've got a pretty well-rounded philosophy for our program.
All right, thank you. All right, so our program is a 3-year, 8-semester year-round program. And so here you can see how the curriculum is sort of designed. Dr. Powers, can you talk to us a little bit about and you mentioned this earlier about the integrated clinical education beginning in the first semester, but maybe talk to us a little bit about the early patient management care and how that applied knowledge goes from the didactic learning into the clinic.
Absolutely. So we do strive for early patient management skills. And here in this picture, you see some of our students working with community members that come into our Balance Movement and Wellness Center. This is where you start to learn those assessment skills and interventions for an integrative and collaborative overall physical therapy practice. Once you apply the basics in these scenarios, then you'll be able to add in your musculoskeletal knowledge as you learn that, and your neuromuscular knowledge as you learn that, and so on.
Okay, so talking about student support for growth if one of our admission ambassadors can talk to us a little bit about the level of support that you receive in the DPT program, talk to us about flocks, and the different areas of support that is offered to you all as students.
Yeah, so the flocks is something that our cohort kind of came up with. There used to be like a PT PAL thing that they used to do where it was like a second year paired with a first year, and essentially that second year would be kind of there to mentor them and kind of guide them through the growths of kind of grad school. We figured, our cohort figured that perhaps doing more of a group scenario would be more beneficial, just because in certain cases, certain students may not personality wise match up with like their PT pal in a sense. So we figured the group setting would kind of have you like kind of built-in friends in a sense. You kind of get a bunch of second years as like mentors, which in this picture you can see all of the second years kind of sitting down there. But yeah, it's like a group setting where essentially you have second years to kind of bounce ideas off, talk about how grad school is like, being able to manage grad school stress, timing, things like that. And we just thought it was like more of an interactive way to kind of get the first year students kind of through the growing pains of kind of grad school. And so far, I think we've found good success with that versus like the PT pals that we've done in the past.
That's excellent. I love it. I love it. And so my understanding is that each student is assigned a faculty coach. Is that correct? Okay. Dr. Powers, can you tell us a little bit about the role of the faculty coach?
Sure. We are essentially your cheerleaders, right? When you need someone to talk to about your career choices, talk to about your study strategies, we are your mentors in that way to help you succeed within the program, but then also beyond the program and out into the workforce. So once you're assigned your coach, you stick with them for all 3 years and beyond in that scenario.
All right. I love that. I love that. And then the last thing I see is grading for growth. I think that's something too that is sort of an MCPHS thing. Could you explain to us, Dr. Powers, what grading for growth is?
Sure. Grading for growth really gets to the skill set of a physical therapist and also recognizing that students are learning and students are meant to make mistakes. You learn from those mistakes. So we allow in many cases retakes of a skill check until you're competent with that skill, or resubmitting an assignment for more credit on that assignment based on the feedback so that you're constantly growing and learning within the grading process.
I like that. Okay, so definitely giving students an opportunity to reflect and have an opportunity to maybe retest or take it again to see how they have grown in that content area. That's excellent. All right, so in the line of student support, Dr. Powers, talk to us a little bit about the NPTE preparation.
Yes. So we try as a faculty to write all of our exam questions in NPTE style so that students are familiar with that style of question long before you get to the board exam. The NPTE is the licensing exam for physical therapists. So we hold regular comprehensive exams in that style, along with your regular course exams. Then additionally, each student will take 3 to 4 full-length practice exams with a full-blown question analysis to really make sure you're feeling ready to sit for that licensing exam. Then your final semester has a 15-week content review with certain available resources with study apps and podcasts. We make a whole lot of recommendations as you're gearing up for that licensing exam.
All right, so along with keeping in line with student support on it, from a university standpoint, we do have our academic support, which is the Center for Academic Success and Enrichment. And there you can find peer mentoring, academic coaching, learning strategies. We also have an Office of Student Access and Accommodations for those students who need it. And then for the career side, there's an annual residency and fellowship panel. There's an annual career fair. University also offers career services as well as university counseling and resources. So the support is definitely in place, and we encourage students to definitely take advantage of these resources available. All right. So, Dr. Powers, tell me a little bit about this slide and how does this relate to the integrated clinical education?
Sure. Integrated clinical education occurs in 5 of your 8 semesters with us. In year 1, you're out on these integrated clinical at these sites in the fall and spring semesters. Some of those sites are more meant for observation, and students are observing the experts in different specialty areas of PT. And then some of those sites are specific to application, and the students get to perform and work with those patients directly. And we do try to line up each semester sites with the content that you're learning. So you might be learning about pediatric care, and then your clinical sites include schools and early intervention programs and those types of settings.
All right. And then you can see here that this is just a couple, very small snapshot of some of the clinical sites that we utilize in the program. So. All right, so this takes us to our Balance Movement and Wellness Center. Dr. Powers, talk to us a little bit about what that is and how does this play a big part in the DPT program?
The Balance Movement Wellness Center is our site on campus for community members to come in who've exhausted an insurance benefit but need continued care, and our students get to work with these individuals. Very often we have both our second-year students and our first-year students working with these individuals. So the second years really get that chance to mentor the first years. They're performing patient evaluations, they're designing and implementing plans of care, all of that occurring with faculty oversight and mentoring.
Okay, and this next slide, tell us a little bit about that.
Sure. We use the BMW, as we call it, to integrate within the curriculum. And our therapeutic exercise courses, our cardiopulmonary courses, geriatrics, and our evidence-based practice courses all use experiences within the BMW within their courses as well. And the working with this clientele often stems and supports research. So research posters are often developed related to the BMW and can be disseminated both on campus and at outside conferences as well.
All right, simulation lab. Now, have our admission ambassadors had a chance to visit the simulation lab yet?
Tomorrow morning.
Yeah.
That'll be our
Oh,
first time in, actually.
tomorrow morning. All right.
Very exciting.
So Dr. Powers, tell us a little bit then about what our admission ambassadors are going to be experiencing tomorrow morning.
Well, our sim lab does look a lot like a typical healthcare facility. You're going to see true hospital beds. You're going to see all sorts of assistive devices and all sorts of lines to manage, from O2 lines to EKG leads, really simulating what it feels like to walk into a hospital room of a patient that you're about to get up and working with. So it allows us to replicate the intensity of some of those higher level settings, those complex settings, but students do tend to have a very good time with it. And tell me, my ambassadors, does this look like a safe lift in that middle bottom photo?
That looks
No,
not the proper way to do a transfer.
That is true. You will start learning proper ways tomorrow.
All right, excellent, love it. Thank you. But it looks like a lot of fun though, so I'm sure that you
Definitely.
guys will enjoy that. All right, so in interprofessional education, as you can see here, this bottom picture shows you how students from different disciplines are coming together. I believe this was a dementia sensitivity training, if I'm correct in saying that. Okay, so
Yes,
it looks
they are.
like people were wearing glasses to blur their vision, or doing wearing gloves to kind of make it difficult to manipulate and to hold things. That's really interesting.
Absolutely. Difficult
Yeah.
to button shirts and make a bowl of cereal in the morning based on all of that sensory deprivation that is common in patients experiencing dementia.
Wow. And is there also a book study involved with the IPE?
There's a book club event all around cultural humility. That book title, The Spirit Catches You and You Fall Down. It's a wonderful book, and we use that and generate discussion around that.
Oh, all right. Okay, so this is some community service examples. Dr. Powers, can you tell us a little bit about that?
Sure. Our PT Service Club loves to get out into the community. Yes, the 3 ambassadors here are part of that club.
Oh.
We celebrate them. We've got pictured here 3 different events that we've participated in, and a lot of this is student-led. They pick and choose what is interesting to them. In the top right picture, these students were raising money for multiple sclerosis research, and they were pulling this jet. That was a jet pull fundraiser. In the top left corner is a photo from Camp No Limits, which is a summer camp to which we send a few students to help children with limb loss. Think of your typical summer camp, but then teaching children who've just lost a limb, who are working with prosthetics, how to reestablish those types of summer camp activities. It's a rather fun option for our students. And then finally, many of our students support the Boston Marathon. We are so close to Boston that it's very easy to support those runners on that endeavor.
Right. It's like a lot of fun. All right, and our research integration, which is really important. Talk to us a little bit about that.
Yeah, we have a lot of research opportunity within the faculty. You can actively engage in research if that is your interest. You could be a part of a data collection like we were doing here with some UMass baseball players. You can always disseminate your research at national conferences throughout And then also, we highly encourage participation in university scholarship days. So typically, each professor has some research going on, and students can volunteer to join them in that and assist them with that throughout the program.
And our outcomes.
Yes, we do have a high retention rate with students and a high NPTE pass rate, as well as the all-important employment rate after graduation. We also have many students that go on to clinical residencies and fellowships. Several of our alumni have gone on to become independent business owners. Really, we have quite a few leaders within our national physical therapy community that are among our alumni. And then our favorite, perhaps, is that some of our graduates go on to become clinical educators and even become adjunct faculty to this program. So we have several of our clinical adjunct faculty are alumni of this program.
All right, thank you all so much. All right, so this is where I come in when it's time to talk about application for admission. So all application materials should be sent directly to PTCAS, which stands for Physical Therapy Centralized Application System. So it is a system where all of your documentation is sent there, and they verify everything for us. Your official transcripts, your letters of recommendation, personal essay, if you have AP scores or CLEP exams, anything like that, you want to make sure that you send it through PTCAS. Prerequisites must earn a grade of C or higher, ideally higher, and science and math courses older than 10 years from the designated start term will not be accepted. So for example, if you're applying for fall 2025, we cannot accept courses that are prior to 2015. So the minimum overall science and math GPA considered is a 3.0. Competitive applications typically have 3 letters of recommendation. However, only 2 are required, with at least 1 being from a licensed physical therapist. Shadowing experience with at least 10 hours minimum is required, and candidates with international coursework must submit a World Education Services evaluation to PTCAS prior to submitting their application. And of course, once all of your documentation is received and your application is reviewed, and we feel that you are a candidate that we're interested in, then you get invited to a virtual interview. And that virtual interview is just an opportunity for us to get to know you and to talk more with you. So when it comes to admissions, MCPHS does have rolling admissions, which means that you can get an admissions decision as early as a week to 2 weeks after applying. The fall 2025 PTCAS applications are now open, and we are in full swing. So if you are looking to apply, I highly recommend getting your application in as soon as possible. Remember to have a competitive application. We consider your cumulative GPA. We look at your prerequisite GPA. We also take into account your interests, your experiences, what motivates you, and of course, your virtual interview. And then we also encourage you to do a campus visit as well. All right, now upon admission, all candidates are considered for a merit-based scholarship of up to $7,000 a year based off of the overall GPA. Domestic students are encouraged to complete the FAFSA, and affordability appointments are available to all accepted students. Your financial counselor is Lynn Berry, and he is available to discuss financing your education along with payment options. And I want to thank you once again for joining us this evening to discuss physical therapy at MCPHS. Before we move into the Q&A portion, I just want to let you know how to reach me. This is my email address along with my work cell. This is the best number to call me to reach me. And if you want to schedule a one-on-one appointment, either by phone or virtual, this is my calendar appointment. You can take a snapshot or picture to schedule an appointment. All right. So there are no questions in the Q&A box. So not sure if anyone has any questions. But if not, last thing I want to do is invite you to visit our Instagram page, which I understand Dr. Joyce is very proud of. He says that he has become the Instagram king here at MCPHS. So please use this to visit. And if there are no other questions, then we want to thank you for joining us, and we hope to hear from you soon. Thank you so much. Have a good evening.